What's up, everyone? It's Brian from the Exact IT Solutions YouTube channel, and welcome to another video where we educate you about all things cybersecurity and try to help you as a business owner, employee, or what have you understand what risks are out there and what you can do to protect yourself. So today's video, we're going to jump into a organization down in Houston, Texas that had a little problem back in January, and they are a medical facility, so they have to follow HIPAA and some other breach laws within the state of Texas. So we're going to jump into that today. We're going to talk about that. So if you're somebody that is worried about HIPAA, that needs to be concerned with HIPAA, you're going to want to hear this story. You're going to want to hear what happened here. And if you're somebody who has clients or you are involved in the medical community, you're going to want to hear this kind of stuff. So without further ado, let's jump into the content for today. Well, it's actually kind of tough for me to tell who wrote this. It's the name of the publication is Becker's GI and Endoscopy. So I'm assuming it's some kind of medical vertical website that caters to that particular industry or that particular sector of the medical industry. And it has to do with this company called Gastroenterology Consultants out of Houston, Texas. And what happened here, guys, is they were attacked with ransomware back in January. And after they were attacked, they decided instead of following the letter of the law and how it's laid out in both the HIPAA and Texas state law for breach reporting, which both of them, by the way, are 60 days, they didn't follow the letter of the law. And now here in August, September 2021, they're going to pay the price for it, unfortunately. And let's talk about what happened here. So in January 10th, they were hit with ransomware. And if you watch my channel, or if you don't, a lot of times with ransomware, you guys that watch this channel all the time, thank you, and you know this, that the data is stolen beforehand, and that is now known as double extortion. And what happens there is the hackers, they not only encrypt your data, but they take it first. And the idea behind this is and this really started because a lot of people started combating ransomware and not paying the ransom because they had backups and they had their data backed up. And for a while there, that worked. For a while, you could just basically, get rid of the system or get rid of the ransomware, restore your data, and move on with your life. And then the hackers got smarter, and they changed their tactics, and they started stealing the information with the threat that we're going to release this. And that's a big deal. And I'm actually going to talk about in another video in a couple of days, something around this, around schools and school districts and children's information being put out there by these criminals. But that's what happens. The information gets stolen. And in this case, public health information or protected health information is now public. And that's a problem because we have laws in this country at the federal level that protect against that. And medical practices and hospitals and anyone in the medical industry that deals with private health information has to do a lot to protect this stuff. And if it gets breached, there's things they have to do to report it. So if you have to follow HIPAA, you're fully aware of this. I just wanted to give that background for maybe somebody who doesn't know what's involved with this. So here we are, January 10th. These guys have this ransomware event. At this point in time, they're not really sure if any data was stolen, which is typical. We see this with a lot of ransomware attacks. Unless you're being told that they have the data, or maybe your information's already posted on their dark web bragging blog that a lot of these guys have, there's really no way to tell, especially if you don't have things set up correctly. Now, there is definitely ways that you can set up technology so you have this telemetry. So if you have an event, you're able to easily look and see, okay, we have this set up. Here's where we go and look. And, oh, yep, looks like data was exfiltrated before they did this. So these guys, they didn't know, they didn't have the telemetry. They didn't have things set up well enough to know whether the data was lifted or not. So what they decided to do, and where they went wrong, was they decided to post a message on their website to all patients. And this caused a problem for two reasons. Number one, you have to notify HIPAA within 60 days, and you also have to notify the state of Texas, being that they were in the state of Texas. So there were two entities that they had to directly notify. And by notify, that doesn't mean put a message on your website. It means you have to write a letter to somebody, or call, send an email, whatever the process is, to these entities to make sure that they have the correct information about the breach that you just had. The other thing that this entity failed to do was they failed to notify every patient that could have potentially been affected by this. By putting this up on their website, they may have thought that they were okay, but they really weren't. You literally have to send a letter to every single patient that may have been impacted by this. So if you have 200,000 patients in your database and you're not sure who got affected and who didn't, guess what, guys? You're sending 200,000 letters to 200,000 individuals to let them know that their private health information could have potentially been exposed. So that's where we're at with this story. And the reason that they're in hot water now is because while they still posted it in March, they didn't do the things they needed to do until August. They didn't notify the state of Texas, and they didn't notify HIPAA until August. And this is many, many months after the event. So they're way outside of the 60 days. And this is really just beginning for them. This is like now the state of Texas and now HIPAA is kind of like going, what the heck is going on here? And this is just the beginning of the fallout from this ransomware event that happened, 8 months ago for this entity. So it's important to note that if you are a medical, any medical where you have private information, dentists, chiropractors, psychologists, psychiatrists, if you accept any kind of insurance, you have to follow HIPAA. And what I know about working in that industry is even if you have cyber insurance or you have some kind of insurance to protect your business around this types of thing, a lot of the language that's within the cyber insurance policies or the insurance policies reflects the same thing that HIPAA does. So you have to notify patients of breaches, etc., or your claims won't pay out. So just because you don't accept insurance, don't think you're off the hook from following these things, especially if you subscribe to or pay for something like cyber insurance, or you have some kind of cyber umbrella over your general liability or E&O. So that's it for today, folks. I'm gonna switch some formats up for some videos, make them a little bit shorter. So if you liked what I gave you here, if you were enlightened anyway, remember, like us out, share us, hit the like button, share us out, and subscribe to our channel. It really helps us out with the YouTube algorithm. The more subscribers we have, obviously you can turn alerts on and things like that. We appreciate all that. We're up to 1,400 and some subscribers. When I started this channel, I really didn't know where this was going to go, but I'm very grateful for all you guys that watch and that pay attention. And I'd love to hear from y'all. I'd love to hear like what you would do if your doctor called you and told you that your information was out there. How does this make you feel, knowing that your medical information could be stolen and traded on the dark web with really you have no control over that? So or have you experienced something like this? Drop it in the comments below. We're actively looking for those comments, and we'll reply, and I'm sure the rest of our subscribers and followers will also chime in. So thank you, and we'll see you soon. Take care.